Using humor in nursing practice is our episode topic. Rejoining us for this episode is a nationally recognized nursing humorist and friend, Terry Foster. Terry is a well-known national speaker both in and for nursing and was the first nurse to appear on TLC's Untold Stories of the ER series. Terry is without a doubt an uplifting and supportive nurse for any patient or colleague that interacts with him, and he used these talents during his most recently completed term as the 2023 president of the Emergency Nurses Association. Terry is a clinical nurse specialist at St. Elizabeth Healthcare in Northern Kentucky. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Terry, welcome back. Thank you so much for joining us again.
Thank you, Nick.
You were back on an earlier episode during Nurses Week, but today we're here to talk about using humor in nursing practice. And so let me start with the easiest question. When did you first know you were funny?
Okay, that's a really good question because I didn't, okay? You may find this hard to believe, but I was almost voted the quietest person in my graduating class from high school.
No way.
That is
No way.
Okay, let me tell you, when they send out the paper where you vote for like best looking.
Yeah. In the year, it comes out in the yearbook, right?
Yeah, okay. They sent out that paper. I was in my homeroom class. So I've been in that class 4 years. Some guy goes, who do we put down for quietest? And this other guy goes, somebody said put down Terry Foster. And the other guy goes, who's she? And this guy goes, it's a guy, I think. And I'm sitting there listening to this conversation. And the girl in front of me turns around. She goes, they're talking about you. I was like, yeah, I know. I was quiet. I guess when I became a ward clerk and stuff like that in the hospital and then in nursing school, I was like, I want to be more outgoing and I enjoy it more and participating in the conversations and that kind of stuff. I'm funny, I'm on, but I am often happy to disconnect, have quiet time, just walk, go for a walk or have downtime or whatever. But I like to inject or add humor or levity to situations for sure. And I've been doing that since I've been a nurse.
Now you do some stand up, but most of what your humor is more improv and going with the flow and going with the situation. Is that right?
I would say maybe 50% both. I do stand up mainly for like benefits and charities and things like that. I've done where if it's a breast cancer benefit or some kind of fundraiser, I'm happy to do that. I've spoken to a lot of church groups and different things. But for nursing conferences, I'm most often like a closer for the conference. They've had a lot of heavy topics. When you've got blood gases, shock, the Krebs cycle, and intracranial pressure monitoring, it's good to end with humor. I can only go up. Okay, so that makes it nice. So there it's a little more structured of a talk. It's probably about 50% there, structure of things, and then another 50% storytelling that I like to do just because I want nurses to have that ability to do that. When I talk about nursing humor, I go over some ground rules because I like to talk about the uses of it and just to proceed with caution. Amongst other nurses, it's fine, never in front of a patient or family. But amongst other nurses, it's fine. Amongst other medical professionals, physicians, EMS, it's fine. Hospital healthcare workers, even law enforcement, I think they get it. Outside of that circle, where it could be just somebody in the general public or whatever, I'm not sure that they get that. that they get how we're using that humor. And so I believe in the phrase, if in doubt, just leave it out, because I don't want somebody to think, man, those nurses are making fun of that little old man. And it may not be that situation at all. So I never want people to interpret it the wrong way. There's ways to use nursing humor that are appropriate and inappropriate. Inappropriate use of any kind of medical or nursing humor would be making fun of somebody's race, their religion, their sexual orientation, anything like that. Off limits, not funny. Just don't even go there. That's just something where I just remind people of that. And for the most part, we don't have to. Some of the stuff we go through or we see is incredible. So appropriate uses, I think, are just laughing at a situation amongst ourselves, finding humor in it. And sometimes it's a little bit difficult to explain, but it's how we cope. And there's a lot of stress in our job, especially since the pandemic. There's so much incivility sometimes, and we're dealing with mental health patients. We're boarding, our staffing issues are every day. Every patient is a train wreck. We're just maxed out all the time. And so you have to find a little bit of humor in the work that we do. And we are our best audience. We all get it. As I said, people outside may not possibly get that. And if I'm at work and I don't know, something happened, it's funny, I can look at a coworker or make some kind of eye contact and we're like, oh my gosh, I can't believe we're laughing at this or whatever. But maybe that smile or that chuckle or just shaking your head is just, okay, we get it. We're going to get through this. And it can decrease your stress. I talk about we all like to work with somebody who's fun to work with. We all like to have fun at work. We do. There's nothing wrong with that. And I like to work really hard. I don't like it when it's out of control, but I like to be busy. And you get your energy from other people when that occurs, but also just having fun at work. That's okay. It's interesting because I do pick up shifts in the ER if they need like help on a weekend or whatever. And somebody will ask me if I can work. And I look at the schedule. And if it's a crew working that day, that's a good group, a lot of fun, there's a good chance I'm going to do 4 8 hours. But if it's a crew that I call wine club that's working that day, I'm not going to work. It's like people who are like, oh, this day's awful, like all that stuff. I don't want to work with negative people. I want to work with positive people and have fun and people who have a good sense of humor and get you through the shift. But I think the point is a positive attitude is very contagious, but so is a negative attitude. And it's just that it's something that people latch on to. What the positivity, hey, we got a good shift, we'll get this done, let's get these people 3 hours, let's get them going on. But it's also, oh my gosh, they're not going to take report, they're not going to do this. And all behavior is learned, and people pick up on that right away. It hurts my heart when I see a really good nurse go to the certain shift on a certain unit, and I'm like, man, they're going to be crispy fried in 6 months because I know who they are. They're working with the ringleaders, and that negative behavior is learned very quickly, as well as positive can be.
So you talked a little bit about positive humor and how to use it appropriately, particularly among coworkers. Do you ever use levity when providing care for patients? And if so, what's that look like? And the risk is certainly greater there than someone where you have established relationships. So if you do it, you got to get it right. How do you do that? Do you do it at all?
That's interesting because I'm very careful about that because you never know how that's going to be taken. If I have a patient who's starting to make jokes and I know it's probably they're anxious or they're nervous and maybe I can help decrease some of that anxiety, I will do that. I'll employ that. Otherwise, I'm just careful about that. It is funny how some things a patient will say and I'm like, okay, this is sort of permission to joke around with this person. I started an IV not too long ago, And this guy was nervous. And when I went in, he was like, "You got one try or one chance." I was like, "Okay." So I got it in, and he said, "Good, you did good." I said, "Hey, I'm glad I did." I said, "Gosh, just think, earlier this week I was washing dishes at the hospital. Now they're letting me start IVs." And they're like, "Oh, great. That's just what I wanted to hear." But again, I say that after the
After.
patient, after key timing is afterwards. It is funny. I had two nurses came to me, younger nurses, and they said, "Can you start an IV on this lady?" The one nurse, young nurse, stuck her once, and the other one stuck her once. And they said, can you try?" And I said, "Yeah." So this lady was like, maybe, I don't know, 60 or something like that. So I walked in the room and I said, "I'm going to start your IV." And she said, "Oh, thank God somebody's going to start my IV who has gray hair." I thought that was so funny. And the younger nurses, they were like, that wasn't very nice." I was like, "No, that I get what she's saying. It's like when you get on a flight, if you look in the cockpit, you don't want to see Jeremy putting on Clearasil or something like that. You want to see Sully in there, see a bald headed gray hair, whatever." But it's just fun. I was like, I'm not offended by that at all. But I will use that levity, and I use standard lines, and I don't mean it to be hokey, but we have so many hallway patients now. As a matter of fact, there's a term, hallway medicine, and like how to improvise doing exams in the hallway and taking care of patients in the hallway and all that stuff. But like sometimes I'll just say to a patient, this is a show out here in the hallway, isn't it? We can give free popcorn for this show here for you." And they're like, "Oh yeah." We've even had some patients who I've said, "We have a room for you." And they're like, I don't want the room. I like seeing all this stuff. That one guy's really drunk down there, and there's this and that. And it's like, you know what? If that makes the wait go a little faster, or their pain is a little decreased or whatever, I'm going to use that. And then there's like, they'll say, that old man was yelling. And I'm like, "That's okay." I said, "He told me that this was the lousiest hotel he ever stayed in." And they're like, "Oh, that's funny." But it's just something that just breaks the ice a little bit. But it also, I try to acknowledge their wait, because coming to the emergency department is 8 hours long event nowadays. You're not quick in and quick out, and something to help that a little bit or whatever. I certainly try to do or try to use.
It amazes me how much patients are able to perceive about the operations in a department, and they can tell when you're working hard and you're trying to keep it somewhat of a jovial is not the right word, but an up
Roger.
tempo and positive environment, that they'll get on board with you quickly. And they'll also get on board as a group quickly with you when there's a horrible situation. I remember a situation where we had a terrible pediatric resuscitation, and everyone in the waiting room knew what was going on. And it was a horrible night. But when that code was over and we did not have a successful outcome, and we had to start digging out of the hole that we had dug ourselves in because nothing happened while we were trying to save that child's life, the entire waiting room was they went a lot. They understood what was going on, and we were doing the best that we could. And it's amazing how forgiving they are when you make them part of the process.
I would agree, and I will always start off by saying, I'll say, "Did you have to wait a long time out there?" And the answer is always yes. And I just say, "I'm really sorry you had to wait so long. We will try to do this and that." And it's not scripted. We really will try to do it. I appreciate your patience. And it's so pleasant when a patient says, "Oh, I get it. I understand. You guys are crazy busy." That part helps me. I feel really bad when a patient says, "I hate to bother you, but I need to go to the restroom," or "I'm so sick," or something like that, because they do see how busy we are, and see all that activity. But I do have some patients that'll say, "No, they're sicker than me," or they, like you say, they know when there's a death, they know when something bad just went down, they know when there's a mental health patient who's crying out. They perceive all of that, and I do very much appreciate that. And again, I try to apologize for it, and sometimes it works. Most of the time it does. There's still sometimes where people are just like, they just get angry and want to lash out, I try to recover from that and or try to do a little service recovery from that. But some things work and some things don't. And I share their frustration. It again hurts my heart when I'm trying to take care of patients in the back and I look at the board and there's 30 people in the lobby,
Yeah.
that, and that's a good day. And there's an 85-year-old out there with chest pain because there's no other place to put them but in a chair. And that bothers me as a nurse, as a human, just in healthcare that things are so different like that now that we can't help everybody. But I still want to. I still want to.
We've talked a little bit about using humor with patients. We talked about using humor in the department and who we can explore that with. Sometimes relationships are strained between one unit or one work group and another work group. For example, the ED nurses and a group of inpatient nurses, or the ICU nurses and the ED nurses. And despite opportunities or efforts to bridge that relationship, sometimes they work and sometimes they don't. How does humor work into that? Have you used humor in that at all, of trying to bridge gaps where there's difficulty between two different groups of opposing views?
Okay, did you say that ED and ICU nurses sometimes do not get along?
Yes, I did.
I'm glad I was sitting down for that. Jeez, oh, that's shocking to hear, but it's been that way forever. Not that it works, but you know what? I will be very honest with you. Humor is a unifying force, and it's something that the use of nursing humor unites nurses. It doesn't matter what era you have worked in, what area you have worked in, what unit, it's that common bond that we get it. And there's stories that I have told at different conferences or in meetings or things like that, that people get that right away, especially at a conference. If I'm speaking to a group of nurses about funny things that have happened and stuff like that, the biggest compliment I can get, and I really mean this, is when a nurse comes up to me. I might be in Minnesota and they'll come up to me and they'll say, "Oh my gosh, you had to have worked at our hospital. You had to have worked on our unit." That same scenario, or those people you're talking about, we get that too. And I'm like, no, I've always worked in the Northern Kentucky, greater Cincinnati area, but I understand how that is. And we can relate to that so well. And I think that's one of those things where it's a commonality and it's something that, as I said, can unify us. There's a lot of divisiveness in nursing about a lot of different things. One thing I think that we all want is we want really good patient care. We may have very different approaches to it, but we want good patient care. And whether that's the emergency department, the med surg unit, the ICU, or whatever, we still want that. And most of our nurses are fairly assertive people. I want an assertive nurse taking care of me when I need it. I don't want a quiet nurse that just goes with the flow. And I think, again, that's the thing with the humor, is that usually an assertive nurse is also a funny nurse about things and gets it and can have those clips and those little barbs and that kind of stuff, that they get it right away. And I can take a patient up to ICU and just look at a nurse and I'm like, yeah, here's what's going on. And I know this isn't the best scenario that I'm giving them, but they know I've done everything I can. But the reason they're going to intensive care is because we can't provide intensive care for a long period of time in the emergency department. We have to go to this unit. We have to go to OB. We have to go to the neuro unit. That's that specialty area that patient needs to go to. And this is what's going on here. And there's sometimes I've given a report and they'll say, "What's this look like?" or whatever. And I'm like, you know what? I don't know. I have no clue, but I'll check it when we're on our way up to see you. And sometimes they laugh about it. Sometimes they don't, but it's whoever. I've never worked with a perfect nurse. And if I ever did, I would be extremely suspect of that person. It's like we all have our idiosyncrasies, we have our weaknesses, but we're there for the patient. Hopefully we're there for the patient. So
If I'm a nurse executive right now in a hospital across the country and I'm looking at my work environment and I'm trying to figure out, how do I bring different groups together? How do I improve the work environment? And I'm interested in interjecting humor as one of those potential solutions. What advice would you have for me?
Nursing humor is a very integral part of a healthy work environment. The fact that people feel comfortable enough to laugh at work, to have fun, to have that camaraderie, and to use that nursing humor, I think is so important. And I also emphasize that I want people to remember these stories because every nurse I know has said, you can't make this stuff up. And every nurse I know has said, we could write a book. And I hope people do that because I used to keep a yellow legal pad in my locker, 1979, and I would just write one thing down that a patient said or a sentence. I never kept a diary or a journal, but I wanted to remember that. And look, so many years later, I'm still talking about these. I remember these stories. And I tell people now, put it in the notes section of your phone. And I've had very experienced nurses come up to me and they'll say, I wish I would have written stuff down. And I say, it's not too late. Just start adding something in the notes section of your phone. If you're waiting for an appointment or you got downtime or whatever, do that because you don't want to lose those stories. But also with the humorous stories, there is a lot of learning that goes on with those stories because
Yeah.
when I'm telling a story, sometimes people think, oh, I know which way this is going. And it's not going to go that way. It goes a different way. So those twists and those turns and that sort of anticipation or things like that are things that I think nurses really value, but also, again, that learning. And as a new nurse, I used to love to go to ER parties, or maybe not a party, but like a get together. And what usually happens, people start telling, I'll never forget this one guy, or we had this one patient. I used to love those stories because I didn't know which way it was going to go. And they're usually very funny. And again, but it's experience that goes along with that, which I think is really something very crucial. And I think storytelling is one of those ways that you adapt to that. And I hope nurses write stuff down. Every once in a while, I have somebody come up to me after a conference and they'll say, hey, oh my gosh, your jokes were so funny. And I'm like, those are not jokes. Those are true stories. Like that, I'm not telling jokes. I'm telling about things that have happened. And sometimes they're astonished. Or the other thing is, Nick, sometimes people will come up to me and they'll say, oh, I got a good story you can use. And I'm like, no, that's your story. These are my stories. I'm not telling somebody else's story. These are my stories. You should tell your stories. And I hope they do because we've all certainly got them.
Going to wrap things up as we're running out of a little bit of time. Rather than closing thoughts, maybe we have a closing story that we can get some good interjection of some humor here for our listeners.
Okay, one of my most favorite stories: working nights. Work nights in the ER, inner city. A guy comes in about 1 a.m, drunk. He was involved in a bar fight. He had a big parietal laceration. Actually, pleasant guy. He was like, man, I'm drunk. My wife knew where I was going. I was out with my buddies from high school. He's 40. And turns out the third bar he was at, somebody got in a fight a few tables down. They didn't even know they didn't know each other. And he threw a beer mug and it happened to hit this guy innocently. Anyway, so I'm like, we'll get you all taken care of. So brought him back and cleaned him up. We got a CAT scan and we got a blood alcohol, and he was very drunk. I forget what his level was, but very cooperative. And it took us a while to suture him and CT, as I said, and dressed him and rechecked his vitals. So he was there a couple hours. So he's sitting on the side of the stretcher. It's 3, 4 in the morning. I said, who can I call to come pick you up? And he said, my buddies brought me in. They should still be back out there. So we go out the lobby. He sees his friend and goes over and starts talking to him. And we had a discharge desk, so I printed off discharge instructions. So I said to his friend, I said, I said, will you be able to take him home all right? And he said, yeah. And he stood up and he wasn't drunk because I know one drunk's brought in by another equally as drunk often, or sometimes one drunk brings in the injured drunk and they drop him off and go back to the bar and leave that guy there for the night. So anyway, so off they go. Probably about an hour later, I went back out in the lobby to bring a patient back, and the guy that's a driver is sitting back out in the lobby. And I said, did you have to bring him back? And because I told him if somebody isn't home, bring him back. I said he couldn't just go home and sleep in a car. He said, no, I got him home all right. And I said, okay, could I ask what you're doing back here? He said, my wife's back there with stomach pain. And I said, did you bring both patients in? And he said, no, I never saw that guy before in my life. And I said, I thought you brought both patients in. He goes, no, I never saw him. I said, what? I don't understand what's going on. And he said, my wife's back there with stomach pain. And this guy walked up to me and said, could I have a cigarette? And I told him, I don't smoke. And then you walked up and said, would you be able to take him home? And he said, I figure I've been sitting here a while. What the hell? I'll just take him home for you all. I'm like, sir, oh my God, I am so sorry. I thought you were his family. He said, no, but his wife like to died when I woke her up. I said, why did you wake his wife up? He goes, you told me he couldn't go to sleep by himself. So he couldn't make it up the steps. So I went in his first bedroom on a ride. He said, I woke his wife up. He said she put her glasses on, put her teeth in, and she came downstairs. And I read that paper to her about they got to wake him up. And I told her to call you if they have any questions. I was like, oh my gosh. I sent a patient home with the wrong family. Like, how does that happen? Like walking out the door, neither one of them said, I don't know him. Or the best writers in Hollywood couldn't make it up. But when you think about it, it was just a kind act. The guy was just like, a nurse said, will you be able to take him home? And he was like, yeah, I'll try and take him home. You can't make that stuff up. You just can't make it up.
Yeah. You can't make kindness up either.
I agree. I agree, man.
Can't make up humor. You can't make up kindness. They're real lived stories. Terry Foster, thank you so much for joining us. Our topic was using humor in nursing practice and nursing leadership.
Thank you, Nick.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.